Okay, it's
Hi.
recording.
Okay, hi, this is Yulia Ben, and in this video I'm going to identify some of the internal structures of the fetal pig. So I've already secured the pig and I've already dissected it, so let me go ahead and show you. This is the anterior of the pig and this is the posterior, and the pig is lying on its dorsal side and it's facing me with its ventral or belly side. So first, let me show you the oral cavity right over here. So this bony ridged area right here is the hard palate. There's the canine teeth right there. This portion right here is the soft palate. Now also this, let me flip it up, this flap of tissue right here is the epiglottis, and there's the opening to the esophagus and also to the pharynx. Now this is the tongue and it has this sensory papilla right here. So moving inferiorly, I've opened up the throat, and so this big structure right over here is called the larynx, and it is the voice box. And you can see that it is located on the trachea. There's the part of the trachea, there's the C cartilages right there, you can see that. So then posterior to the trachea there's another tube called the esophagus, and it's right there. Now this little organ right here is the thyroid gland, and it sits kind of at the bottom of the trachea. And then around the trachea right here is the thymus gland, and also a part of the thymus gland is right here on top of the heart. It's enlarged in the fetal pig. And there it is. So now moving still inferiorly, surrounding the heart on either side are the lungs. Now the heart is encased in a sac called the pericardium sac. And right here you can see the coronary artery of the heart. Now the aorta is hard to see, but it's the largest vein coming out of the heart, so you can kind of see it right there. And then if I turn the heart to the side, then you can see the inferior vena cava coming out right there, and the superior vena cava goes up that way. So now, still moving inferiorly, oh, by the way, the lungs are encased in the pleural cavity. And this right here is muscular tissue, is the diaphragm, and it separates the thoracic cavity from the abdominal or the peritoneal cavity. So this is the peritoneal cavity, and this membrane right here is the peritoneum. Now this large organ right here is the liver, and this vein coming out from over there is the umbilical vein. Now if I lift up the liver, you can see the gallbladder, which is located right there, and it stores the bile produced by the liver. Also underneath the liver is this hollow organ, which is the stomach, and from the stomach coming out and connecting to the small intestine is the duodenum right there. Now this tongue-shaped organ right over here is called the spleen, and still moving inferiorly, this right here is the small intestines, and this is the large intestine. You can tell the difference because these are a lot thicker. Now still moving inferiorly, over here, if I lift the stomach also, you can see the pancreas, which is a gland right over here. You can see it clearly. And the small intestines, the intestines are held together by a membrane called the mesentery, which is right there. Now still moving inferiorly, this right here is the kidney, and there's another kidney on this side. So the ureters are coming out of the kidneys. There's one ureter, and there's another ureter, and they carry the urine down. And this right here are the umbilical arteries, and this is the urinary bladder. Now also this is a male pig. Right here is his urogenital opening, and he did not have the urogenital papilla. So this is a male. Here's was his scrotum sac right here, and there's the one of the testes right over here. Also, let me go back to the oral cavity, because I forgot to mention that the buccal cavity is also called the vestibule, and is around in between the lips, the teeth, and the cheeks. That's where the cavity is. So I think this is it. So thank you.